Now, experts are warning that the fifth wave of COVID-19 is upon us, and there has been a significant rise in daily infections, with the positivity rate now sitting at just under 20%. However, the DA is not sure if Gauteng hospitals are ready. The province has over 11,000 active cases, with that number set to rise. So let's discuss this with the DA's Jack Bloom. He joins me now to take this conversation forward. And thank you so much, Jack, for your time, and good morning to you. Once again, of course, when we talk about the fifth wave of COVID-19, the spotlight is placed on the healthcare system, its capacity, particularly infrastructure and hospitals. And you are concerned that Gauteng-based hospitals may not be ready for this expected fifth wave.
Well, I'm really concerned about the top leadership, because this department has been without a permanent head of department for 18 months. Only yesterday was there an announcement of a new head of department. So a new person is coming in and facing a potential crisis. There hasn't been a permanent appointment of a chief financial officer either, and there's other senior points in which they're senior posts in which they're acting personnel as well. Now, that's not a good sign for this department, which is notorious for scandals over the years. And the real problem at hospitals is lack of staff. A number of COVID staff that were specifically appointed for the epidemic have been let go as at the end of March. And our hospitals are perennially understaffed in the first place. We saw the complaints at the Chris Hani Baragwanath Hospital. Other hospitals are similarly plagued by short staff. And the real scandal, of course, is that there were hundreds of new wards built specifically for COVID patients, but they're not staffed either, and they don't have equipment. You must see this in the context of a very highly stressed hospital system in Gauteng with massive backlogs of operations. I estimate that there are more than 20,000 patients waiting for operations because of various problems.
Yeah. What work do you think lies ahead for the new head of department here of the Department of Health, just recently appointed, as you reminded us, by the Premier yesterday? Because, like you rightfully said, when you look at hospitals such as Chris Hani Baragwanath, when you look at the likes of Helen Joseph, we know that early on in March we've seen those protests by some of the doctors narrating how it's so difficult to work under conditions where patients do not have food. They have to bring in food, for patients, amongst other things, but also the financial mismanagement within these hospitals at dire states. What work is rather cut out for her, do you think, right now?
Well, to come into this situation is a daunting challenge, and I really wish her all the best. But the reality is that we're faced with the challenge now, and you can't, rectify deep-rooted problems overnight. So you must do the best with what you've had. But I do think there needs to be urgent hiring of medical staff. I mean, that's absolutely critical. And we go into this next wave of the epidemic with the Schadenkleke at Johannesburg Hospital is still partially closed. Now, we know the effect this has on a hospital like Helen Joseph Hospital. If you go there now, you will see people sleeping in the corridors of casualty. How's a hospital like Helen Joseph Hospital going to cope with a new influx of patients? I mean, that's the real problem. And it's just a massive tragedy that there was extra funds made available by the national government for the COVID epidemic. And my estimate is about 2 billion rand of that was just simply wasted. There's a ghost hospital on the far west rand, the Anglo Ashanti Hospital. They've spent well over R500 million on this hospital. It's in the wrong place. And it's empty now. This hospital was supposed to be for COVID patients. Now, it just a white elephant, a ghost hospital. And there's similar examples of wards right across the country that were built. They don't have staff. And unfortunately, I don't know when the provincial government is going to wake up and just fill all the vacant posts, because there's a massive number of vacant posts, and listen to the staff at the hospital. Patients are really suffering. There's so many backlogs with operations. There's the usual crisis in our hospitals. On top of this, it looks like we're going into another wave of COVID cases.
Yeah, and with that being said, have you engaged the department?
Well, I've raised these questions constantly, and I've asked repeatedly why it's taken so long to fill the head of department position, and the chief financial officer position is still filled by an acting person. I mean, this is just completely wrong. I think we need to have all the top positions filled, and make sure that hospitals have top leadership as well. You know, there's a hospital in Gauteng, the Rahima Musa Hospital, where the CEO has spent many days working from home. I think it's inconceivable that a CEO is allowed to work from home, you know, even with the advantages of Zoom and cell phones. I mean, a CEO should always be in the hospital. And of course, Rahima Hospital is the hospital where we saw videos of pregnant women sleeping on the floor. So I think there's still, after so many years, the crisis at the Gauteng Health Department has not been effectively tackled, and I'm afraid that I feel very sorry for overworked hospital staff who just have to do the best they can to save the lives of patients. They shouldn't really work in such poor conditions. They deserve a lot better, as do patients.
Yeah, and hopefully, of course, we can get the new head of department in the Department of Health in Gauteng just to answer to what exactly is the plan here, because you did engage government as well as the department, as you've mentioned there, Jack. But thank you for speaking to us and highlighting this matter for us. Quite concerning if indeed experts, you know, emphasizing on this fifth wave that is looming, or at least expected based on the numbers we're seeing of COVID-19 cases, then we have to definitely see that the spotlight on Gauteng hospitals, or even hospitals nationally, quite frankly, is, of course, interrogated. Thank you so much, Jack Bloom, for your time.